Imagine waking up every single day with this sharp, electric pain just shooting down your leg, literally holding you back from the life you used to live. For millions of people, that's the debilitating reality of complex spine issues. So, welcome to this explainer, where we're looking at the source material surrounding a massive paradigm shift in pain relief, the endoscopic spine revolution. Today, we're going to demystify the rigorous medical pathway to see exactly what it takes to qualify for this microscopic, minimally invasive procedure. And just keeping our legally required disclaimer in mind here, remember that this explainer is strictly for educational purposes. But honestly, it just might change the way you think about spinal health.
Right, so before we get into the surgical funnel itself, we need to introduce the clinical authority guiding today's insights, Dr. T. His background is absolutely crucial here because he holds elite dual fellowship training at Stanford University in neurosurgery and the Texas Back Institute in orthopedic surgery. Now, you might be wondering, why does that specific combination actually matter to a patient? Well, think of it this way. Orthopedic training focuses extensively on the structural scaffolding of the body, right? The bones, the joints, the mechanical load. Neurosurgical training, on the other hand, focuses on the incredibly delicate, high-stakes wiring, the nerves in the spinal cord. Having an expert who has meticulously mastered both the scaffolding and the wiring, well, that sets the absolute highest standard of care when you're navigating the complexities of the human spine. Okay, let's quickly look at our roadmap. We'll be moving through a precision funnel today, covering the endoscopic spine revolution, the conservative treatment test, pinpointing the pain generator, the diagnostic workup, the ideal surgery candidate, and wrapping up with outcomes and fast recovery. Let's dive right into Section 1, the endoscopic spine revolution, a true paradigm shift in pain relief. Moving to Section 2, the conservative treatment test, or how you actually earn your candidacy. So, the very first major filter in our surgical funnel is a strict timeline of non-operative care. Candidates must undergo a 6 to 12-week trial of conservative treatments. And look, this isn't just about resting and taking it easy. It involves highly targeted physical therapy for core stabilization, pharmacological management using specific medications, and selective injections like epidurals or targeted nerve blocks. Now, a lot of people think that if they don't get better during this phase, their body has somehow failed. But actually, scratch that, it's the exact opposite. Failing this 6 to 12-week trial is the medical prerequisite that unlocks your surgical candidacy. Think of it as a diagnostic tool. If you get a nerve block and feel absolutely amazing for a few weeks, but the pain comes rushing back the minute that injection wears off, it definitively proves you have a physical, mechanical block in your spine. It proves that no amount of stretching is going to fix that structural damage, and a targeted intervention is genuinely the only logical next step.
Which brings us to Section 3, pinpointing the pain generator. We have to identify the right kind of pain.
Moving down the funnel, doctors have to meticulously distinguish between the types of pain you're experiencing, because naturally, an ultra-precise tool requires an ultra-precise target. On one hand, we have vague, generalized axial back pain. Think of this like a deep, dull ache across your lower back. Because it's so broad and diffuse, it doesn't typically qualify for endoscopic surgery. The microscopic camera is just too small to treat a massive generalized muscular area. But on the other hand, we have sharp, localized, shooting radicular pain, commonly known as sciatica. Imagine stepping on a live electric wire and feeling a sharp jolt shoot all the way down a specific path into your leg or arm. That live wire feeling is the exact symptom of severe nerve compression, usually caused by herniated discs or spinal stenosis. That sharp, shooting nerve pain, that is exactly the kind of structural problem this procedure is built to fix.
All right, Section 4, the diagnostic workup. This is the high-tech targeting system.
Once we know the type of pain, doctors deploy an advanced targeting system to map the spine and confirm the exact source of your agony. An MRI is the gold standard here, giving surgeons a perfect map of the soft tissues and nerve compression. But they pair that with a CT scan, acting as a detailed blueprint for the bony architecture, checking for calcified bone spurs that might be trapping a nerve. Then there's provocative discography. This is actually pretty fascinating. Doctors literally inject a contrast dye right into the disc under highly controlled pressure. Why? To see if that specific pressure perfectly mimics your daily agony. If they inject the dye and you say, ouch, yes, that is the exact shooting pain I feel when I try to walk, then boom, they found it. They've established a definitive, direct correlation between your subjective pain and an objective anatomical problem. And when this clinical history is combined with that triad of advanced imaging, spine specialists can achieve up to a staggering 99% accuracy in identifying your true pain generator. I mean, they are not guessing here. They are locking on to the exact millimeter of structural damage causing your suffering. Just imagine the profound emotional relief of finally knowing with 99% certainty that your debilitating pain isn't a mystery. It's not all in your head, but it's pinpointed right there on a screen, ready to be fixed. Section 5. The ideal surgery candidate. Let's look at safety, especially for high-risk patients. Once that exact pain generator is isolated, we have to look at who benefits the most from this specific approach. Traditional open back surgery usually involves a massive incision, cutting and stripping muscles away from the spine, operating under the heavy risks of general anesthesia, and leaving a high risk for epidural scarring. Endoscopic spine surgery completely flips the script. It uses an incision less than a single inch wide, literally about the size of a postage stamp. It causes absolute minimal tissue damage, avoids general anesthesia completely by using local anesthesia with mild sedation, and actively prevents that dreaded scarring. Because of this incredibly gentle approach, this is the premier, ideal option for seniors and high-risk patients who are routinely disqualified from surviving traditional open surgery. It gives them a totally viable, safe path. And finally, Section 6. Outcomes and fast recovery. Getting your life back. For the patient who successfully makes it through this rigorous selection funnel, the rewards are absolutely phenomenal. For the ideal candidate, endoscopic discectomies boast a massive 95% success rate, and the safety profile is just as impressive. During the procedure, surgeons use continuous saline irrigation. This means fluid is constantly flowing through the ultra-thin surgical tube, quite literally washing away bacteria in real time. This dramatically drops the infection rate, making complication risks incredibly low for the patient. But the recovery timeline is truly where this revolution shines. Because there is virtually no collateral muscle damage, the muscles are just gently split apart with tiny dilators instead of being violently cut, the body doesn't have to heal from massive surgical trauma. Thanks to this, 90% of patients are clear to return to work in just 10 days. And since this is almost always an outpatient procedure, most people are walking out of the surgical center the exact same day, resting comfortably in their own bed that very night. So if you've spent 12 agonizing weeks failing conservative treatments, and you find yourself trapped by that sharp, electric, shooting radicular pain, you really have to ask yourself, is the exact source of your suffering actually your ticket to candidacy? Proper diagnosis changes absolutely everything. Thanks for joining me for this explainer today. The tools to take your life back and return to a life of movement and joy exist. The question is, are you ready to explore if you're a candidate to use them?